So thank you everybody for joining me in and taking time to listen. So today I am speaking about COVID-19 recovery, the rehabilitation perspective. And my name is Shaloo Choudhary. I am an occupational therapist. Um, so I'm going to start with a disclaimer and a disclosure. So I just want to you know, provide the input to everybody, but this program is intended for educational and informational purposes only. If you are dealing with symptoms, and you make sure you get a clearance from your medical health professional before using the suggestions and strategies. And also disclosure, I do not have any financial disclosure. I do work in Piscataway in an outpatient clinic. So what is the objective of this talk? Let me minimize this, sorry. So the objective of my talk is to increase the community awareness about lingering symptoms. And I wanted to talk about the COVID long haulers and also the self-management strategies we can use. And I do want to start with my talk, just like saying those of us who have been suffering with COVID or who know any loved one who suffered from COVID and the symptoms are still lingering, that you're not alone in this journey. As of this morning, 10:29, globally, there has been, and it's a huge number, so I'm going to just say it out, 135,446,538 confirmed cases of COVID-19, including 2927922 deaths reported to WHO. And as of April 8th, 669,248,795 vaccine doses have been administered. So none of us is alone in this journey. And so, but we have to move together to, help manage these symptoms. So I said, all of us have heard a lot about the COVID. All of us have heard a lot about, how COVID reacts and, what the disease process it. But then the word which is coming out is the COVID long haulers, is the long COVID. A lot of people are talking about it. There are not more news articles and also news stories which are coming up. So per CDC, the long COVID symptoms can appear weeks or months after the initial infection. It can happen to anyone who was asymptomatic or had mild or more symptoms. And some of the common reported symptoms, and this is per CDC side, are chronic fatigue, shortness of breath, muscle weakness, jointal muscle pain, dizziness and vertigo-like symptoms, ringing of air or tinnitus, whichever way you say it, or hearing loss, balance issues with increased risk of falls, difficulty walking, difficulty with memory concentration, commonly known as brain fog, sensory overload, that is increased sensitivity to certain sounds, lights, textures, smell, etc., difficulty with stress, sleep difficulties, and disturbances. And I think the list of these long COVID symptoms is increasing. These are, at least for now, which has been documented. So before we go over these strategies, I just wanted to talk a little bit about the autoimmune system. We have heard about how COVID affects it. It all depends on our immune system. Any infection. So what basically the immune system is, it's, our own defense reaction. So when we were evolving as humans, in the primitive phases, our ancestors were living in jungle, in caves. So there was always threat of the animals or always threat of the environment. So we are hardwired for that immune system response, which is a fight, flight, or freeze, or rest, or digest. It's controlled by the autoimmune system, which is our sympathetic and parasympathetic nervous system. So we all know about the brain, that, that's our central nervous system, which controls our muscles, our joints, it controls our walking, controls, how we think and react. But then there's also a nervous system which controls more autonomic things like breathing, how the eating, digestion, swallow, our heart, our lungs. They are not related to brain. Brain is related to everything, but they're not controlled by brain, the central control. So they have their own nervous system, and that's get influenced by stress, that gets influenced by breathing, that also has lymphatic flow, which influences it. So there's a lot more influence factors which impact the autoimmune system in a negative way, but then we can also create an impact in a positive way using those strategies. So fight, flight, freeze, or rest, digest, these are all balancing system. It's almost like, we all have heard it, like when there's a stress, the body either, so flight could be either like, we're not flighting as like a taking a flight, but maybe when to duck down, when to fight it, and then freeze mode. So usually like in animals, like you must have seen or heard the word like playing possum, where this possum thinks that somebody's going to attack or eat him, he just like plays dead. So those are like normal reactions. And in the body, we see it in the form of stiffness. In the body, we see it in the form of people like having dizziness and stress. So there's a lot more things. So we have to make sure that the balance between the sympathetic and parasympathetic system gets better. So talking about the stress. So, a lot more stress, whether we're dealing with an illness, long effects of illness, or seeing a loved one going through it. So, and also just day-to-day life, it's hard to deal with the stress. A couple of weeks ago, Piscataway Library had hosted a great workshop on, I think, on the stress management by a psychologist. She was talking about like getting into the community. So if you have not watched it, I would suggest, check the Piscataway YouTube site and then watch it. But what I suggest my patient is to look at the sleep habits, sleep hygiene. Are we sleeping at a certain time? Making sure that there is a set time for sleep, making sure that the light is off. And then also electronic devices are put away. And if the sleep is disturbed, maybe seeing a medical professional for that, maybe a sleep doctor, and seeing, we don't have the sleep apnea or anything else. The other thing which helps is like developing positive coping skills, and then engaging in hobbies, any hobbies, whether we play a sport outside or whether we're doing indoor, listening to music, dancing, gardening, indoor, outdoor, playing puzzles, or just talking to friends, like whatever hobbies is that would help us to break the stress and also help to distract the brain attention in a good way. Maintaining active lifestyle. So by regularly exercising, walking, and you're going to hear me talking about active lifestyle in pretty much every slide. Doing breathing exercises. It's very much research based to do the breathing exercises. And as I was mentioning about the autonomic nervous system, the fight, flight, rest, freeze response, rest and digest response, that's related to breathing exercises. The diaphragm or diaphragmatic exercises can influence that. So, please do that. Meditation has been proven to work for stress management. Laughing, and then at the end, just seek professional help. If you don't think you are able to manage your own symptoms, reach out. The other common symptoms with the long COVID is the fatigue. Now, dealing with the fatigue is an uphill battle. It's an uphill battle just to know when to start, when to stop. So, as a therapist, a physical therapist or occupational therapist, we generally teach our patients how to do the fatigue management. We teach our patients about energy conservation, pacing, activity modification, and then of course, creating an active lifestyle as much as possible. So when I say about fatigue management or energy conservation, what does I mean by that? It means that, so say for example, if somebody who is very fatigued and they're not able to stand in the kitchen and prepare a meal, maybe they just don't have the muscle strength to stand, or maybe just the balance is not good, or just don't have the endurance to stand for it. So a lot of time I'll talk to the patients, we'll analyze it, like how their kitchen structure is. Maybe we'll ask them to put a chair so they can, sit or stand in between as needed. A lot of time I'll talk to my patient and see maybe instead of cooking a full meal at one go, maybe they can do a prep, like sitting, like maybe chopping the vegetables sitting or prepping ahead of time. So a lot of time, we work with like one activity, analyze it, and then help the patients do it. The energy conservation is very important, but, so I also tell my patients is energy is like money. We're very conservative in how we utilize the money. So same thing, we have to use the energy with. When you're recovering from the system, you don't want to do everything and run out of steam. You want to do it slowly in smaller increments, and then slowly and gradually gain the endurance to complete it at the speed you were used to it. Other symptom which happens is the muscle weakness. So that happens when somebody is in bed, or they're just coming out of prolonged illness, or a lot of time with the COVID, I have seen it, patients are having prolonged hospitalization, then they go to rehabs, and then they come home, but they are just so debilitated that they're not able to get up. So the muscles get weak, they get atrophied from non-use. So what can help is the flexibility exercises, whether choose to do the general stretching exercises, yoga, Pilates, using foam rollers, they can help. Light aerobic exercises help. Walking is generally very helpful. Indoor walking, outdoor walking. Like right now, the weather is improving, so consider going outdoor, get some vitamin D. And then light activities like even like dancing, sitting or standing, you can have the benefit for the stress, as well as music does wonders for patients. So maybe put music and just like encourage to dance. Then also you want to like sitting more than lying in bed. So all our, like when we do the strength training, or our body, we are conditioned, or we use, the way we have evolved is like we respond against the gravity. That's how we are. We're walking against the gravity. We're eating against the gravity. Everything is a relationship to gravity. So when somebody is lying down, our own internal balance systems, or our sensors, which are in the internal ear, that system gets suppressed. So where the body is not able to cope up against the gravity or in relationship to gravity. So laying flat, unless it's like doctor recommended, like that's the position should be in, you should not be in that position for a long period of time. So make sure you're sitting up either in reclined position or semi-reclined position, or sitting up with support, without support, till you're able to get better to a stage where you can stand and walk. The next symptoms, which are fairly common and they're getting a lot more buzz these days, are the balance and dizziness. And why they're important is because the balance and dizziness can lead to fall. So when somebody's recovering from an illness like COVID and the symptoms that linger, the last thing we need is a fall. So we need to prevent that fall or loss of balance at any cost, because not only it can impact physically, but also emotionally, it can erode the confidence. And so just functioning in normal day-to-day life can make it challenging. So to the patients who are the reporting are the spinning sensation or imbalance when changing position. So a lot of time people are saying when they're changing position in bed, or sitting to lying down to sitting, or when they're bending down to pick up something, they're getting a little dizzy, or like the room is spinning for them. They're also complaining of ringing of ears or tinnitus, hearing loss or earfulness. They're experiencing signs of eye fatigue. This is like a very common thing, which I'm hearing from patients who are recovering from long time, is like they feel like their eyes are burning, or they're just so tired. And I think it's all related because the body has been in such decompensated position, in lying position, that the eyes are working so hard to work or adjust against the gravity. So the eyes are feeling that. Then losing balance when sitting without support. So say sitting at the edge of the bed to dress and people are falling backwards or sideways. Losing balance when standing for a long time with or without support. And then walking into the walls, losing balance, bumping into stuff, or unsteadiness, whether we're walking on the hardwood surface or carpeted surface, or on the grass or paved surface. So there's an amount of unsteadiness which is there. And as I said, like all these things relate to fall. So we need to be really careful about falling or not falling, and then put some strategies or know certain things for fall prevention. So the first and foremost thing I would suggest is know your balance. If you have experienced any of those things, sitting or standing, where you feel the balance is not there, or the dizziness not there, is coming up and change of position, then seek some professional help. And also try to stay active. Then you want to use the cane or walker if that was recommended in rehabs or in hospital. You want to get your eyes checked, make sure that they are functioning okay. A lot of time, the aging eyes, there's an eye health issues with the diabetes or macular degeneration or glaucoma. Those things are there in the background, and then this disease happens, and then all those things gets compounded. So make sure you check your eyes. It's not all about the acuity, how how much can we see up close or far. It's also about how the two eyes are teaming up. How's my focus? How's my any blurriness is there? So please get your eyes checked if that becomes an issue. You also want to get the hearing checked, and the hearing loss has been associated with falls for a long time, but now with the COVID, this is like one of the newer symptoms which is getting reported is hearing loss, ringing of the hair or fullness. So get your hearing checked. Then you also want to know the medication, that is there any medication which has been prescribed to me, whether before or after or during, which can cause dizziness, or there's a drug-to-drug interaction. So either you check with your healthcare professional or you check with the pharmacist and just make a list of those medications. Other thing which I tell my patient is like sometimes we cannot predict a fall. Things happen. However, we can create an environment where we can make ourselves a little bit fall proof. That doesn't mean that we're going to put mattresses like all around, but that means that we can just scan the environment for any kind of environmental hazards. So if there's a lot of clutter in the house, we can keep the house a little bit less cluttered, especially if we're using cane or a walker, or we just don't have the ability to walk as good as before. We want to make sure that if there's any loose rugs in the bathroom, in the kitchen, or a runner on the stairs, either we remove them or they've been glued down, like extra support. You want to also check the lighting inside and outside the house. Very essential. A lot of time we're creature of habit. We know our house, so we're walking to the bathroom at night without turning the room light on or the night light off. When we're recovering from a balance issue or when we're recovering from a long illness, a lot of time our eyes are dependent on the light to regain our balance or just keep our balance. So, taking the light out can put us at a risk of losing our balance and falls. So, just use the night light if that's the case. And if grab bars or high toilet seats, anything were recommended, use them. The next important topic is the brain fog. So, when we're saying brain fog, the symptoms patient can occur is confusion, short-term memory lapses, mental clarity. So a lot of time I've been hearing is that I'm not as sharp as I used to be. Things are not clear. I'm not like my response system when I'm trying to balance my check or do online banking. I'm not as quick as could be. So it's impacting the attention and concentration. And it's a lot more common in the population who had developed some breathing issues or they were intubated and stuff. So this is becoming a much more prevalent symptom next to fatigue and breathing, the brain fog. And how do we counter that? Of course, you want to talk to seek professional help, if things are lingering longer. But staying active, brain is like any other body parts. It needs oxygen. It needs the toxins to be removed. So engaging in some form of meditation exercises or just, that helps to decrease the brain chatter, is what we call it. Having good sleep, doing some breathing exercises, light aerobic exercises, staying active physically and mentally. So physically we're doing the exercises, mentally you can do, use the puzzles, use the board games, anything which would stimulate or new thinking. Reading is a good book. Usually TV is okay, but that is more of a passive stimulation than an active. So you want to do something which would cause you to use the brain, even simple like basic mathematics or like doing some kind of a puzzle thing would be helpful. Then you want to make sure that we're paying attention to our nutrition. So have proper nutrition, have proper hydration. And like as I said before, seek professional help if these symptoms are lingering longer and they are impacting the quality of life. Get some help. There are also, community-based supervised exercises. So I want to bring that attention, so a lot of the patients who are recovering from COVID, they get some therapy in the hospital, then they get some therapy at the rehab, then they get some therapy at home. But there are also community-based outpatient physical and occupational therapy clinics available, and these services are covered under insurance. So do not hesitate to talk to your doctor or healthcare provider to get a prescription for therapy. Then there are also step-down programs called medical wellness, where you've reached the maximum level at rehab, but you're not ready to go to the gym on your own, so you need a little step down. So there are group supervised programs which are available. So a lot of the clinics are attached, or they have some relationship with the personal trainer or exercise physiologist where they can come up with a common program. Then there's aquatic therapy, water therapy, but just make sure that you get the clearance, you reach out to your the healthcare doctor. So lastly, I'm going to start talking about the breath work. So science backs the use of deep breathing exercises to improve function, overall function, brain function, pulmonary function, just body function in general, how we manage our stress, and everything. It affects the stress, and also it has been proven to improve the sleep. Now, many of us do not know that the breath work, the diaphragm work is, when the diaphragm is moving, it also impacts the pelvic floor. So it's the core strengthening exercises. And the beauty about the breathing exercises is can be done in laying down in bed, sitting and standing. And you can combine breathing exercises with any other exercise you do, so you can get a double benefit. So they can help with the core strength. A lot of time when we're in bed too long, the back is hurting, or the legs are hurting. So the back pain also gets better doing the breathing exercises. Now, the diaphragm is related to the lymphatic system, which removes the toxins in our body. So it's also great to facilitate that. So diaphragm exercises. Now that is also related to the autoimmune system, so helps to balance that parasympathetic and sympathetic system. I recently attended a workshop at WHO regarding the rehabilitation of the COVID program. So a few of the next slides, I thought I'll share it from the WHO sites. They were like very well laid out and well researched. So the education for breathlessness. Now, some of us have pulmonary diseases even before COVID, like patients have COPD or any kind of pulmonary function disorder. We know that when the breathlessness is there, it adds to the stress. It just adds to the anxiety too. So, making sure that patient understand that breathlessness, like how to manage that, is important to stay calm in that situation. And staying calm just does not happen, but just like, staying calm, you got to put like an active effort in it. So learning different breathing techniques, also learning various positions which can help with the breathing. So that's it, because if we breathlessness, then it adds to the fatigue, and then it adds to inactivity. So there's like it's a vicious cycle. So we want to make sure that we give the strategies to the patients and the community members so they do not avoid exercising and get weaker over the time from like non-use of it. So these are some of the breathing positions which had been recommended by WHO. So the first position is the high side line, so it's like lying sideline, putting some pillows, propping it up, forward leaning, sitting with the pillow, or forward leaning if there's no table in front. Then standing with the chair leaning and standing with the back support. And then as we're standing, it's also important to just do some basic, simple breathing, like inhale through the nose, exhale through the mouth. A lot of time I teach my patients is like, just using that like visualization, like smell the roses, blow up the candles. So just like very, very simple, we can do it. The next slide is also important, where, you have there's listed about different breathing techniques. The one technique is the square box breathing. So very simple to do it. lot of us who have done the yoga, like they know there's a component of yoga called pranayama, and then they teach a lot of breathing, and there's an opposite nostril breathing where you breathe through one nostril, hold, and breathe out through the opposite. This one is a little similar and different. That doesn't matter which nostril you breathe. You just breathe in for a count of 2, like the my slide says 4, but I would just start with even 2. You breathe in for the count of 2, you hold the breath. You don't have to pinch the nose, you just hold the breath for the count of 2, breathe out to the count of 2, and then hold that. So kind of like a square, and do it 4 or 5 times in one go. Take a rest and then do it again. And as you get stronger, you can increase your hold to 4 seconds, or you can increase the breathe in count to 4, but keep it a square. Don't make a rectangle, just keep it a square. The other breathing you can do is, just like simple, just make sure neck and shoulders are relaxed. And as I said, like breathing in through the nose, breathing out, then you can count like 2 breaths in, 4 breaths out, 4 breaths in, 8 breath out, or 4 breath in, 4 out. So you can just play with those numbers. Now, one thing I'm going to caution is, like when we're doing the breathing exercises, depending on how quick and how deep we breathe, sometimes it causes a natural physiological reaction of dizziness. You just feel like a little dizzy. Don't panic. It happens. It's a normal reaction, or a little abnormal reaction, but it's a physiological reaction. Just at that point, just bring your eyes to a steady point and just normal breath. Forget about any numbers. So then you can also do some pursed leaf breathing, like, where you're breathing in and creating it as if you're blowing a whistle or blowing a candle, like, so try different things. So it's a regular practice. Breathing is like a regular practice. So the more you do it, the better you can get. There's no set number of times you can do it. You can do it like maybe every hour, like 5, or every 2 hours, 5, depending on, how you're feeling. These are some of the seated air yoga exercises I put in, just as an examples, but make sure, if you're not too sure about your balance, and if you have any restrictions, if somebody has a spine condition, you cannot bend forward, then don't do it. So this is just like as a reference point. I just thought I'll put some chair exercises, seated exercises for us to do it. But if there's any doubt, just check with the doctor or therapist. There's another good handout from CDC about the chair as exercises. It will help very well with patients who are dealing with some leg weakness and a core weakness, so sit to stand kind of thing. So just, be very careful as the steps are laid out, so just follow it. And I'm going to end my talk with this, my favorite quote from Dr. King, that if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you got to keep moving forward. We cannot let this pandemic and COVID, just put a dent in our life altogether. So we just have to, as a community, move forward and help each other out. And that's what my intention has been to share. So if anybody has any question or want to talk to me further, feel free to shoot me an email or call me at this number. And I want to thank you all for listening to me, attending to me, and thank you, Piscataway Library, for giving me an opportunity. So I think I'm gonna, where is Karina?
Here I am.
Okay.
Thank you so much, Shaloo. Does anyone have any questions? You can hop on the mic and ask, or you can pop the questions into the chat. We have people in the chat saying this was very informative. Thank you, and that they learned a lot.
I have a question. Can you hear me?
Yep, we can hear you.
Okay. Sorry. So I apologize. I hopped in late. So if you already covered this, I apologize for redundancy.
Please ask.
So the symptoms that you described and the exercises that a person who's recovering from COVID can do to sort of mitigate them. How concerned should a person be, if they, are doing if they're doing the exercises, they're taking it easy as you suggest, and but they continue not to feel better. I mean, obviously they should be contacting their doctor
Right.
on a regular, but like what sort of is the outside limit of like, okay, I've been doing this for 3 weeks, I've been doing this for 3 months, and I'm like,
Not 100%.
yeah, okay.
So I think, what I generally tell my patients is like, it's like restarting the gym or starting the gym.
Mm-hmm.
So anytime we start a gym or starting a new exercise, we get tired, but then there's a recovery period in it.
Mm-hmm.
So if our recovery period, like, so if somebody's doing the exercises, for instance, and the same exercises, like, for 3 weeks and nothing has changed. So I'm going to look at like what's my recovery, like, is if what is impacting it. Maybe the exercise level is either too high, maybe the resistance level is too high, or maybe the time frame is too high, or maybe just my body is just not ready for that kind of exercises. And then the recovery is either longer, or it's just like, or the body is just not able to recover it. Maybe just putting maybe like a little gap in between, maybe instead of doing every day, just maybe skip a day kind of thing, or changing the time, of the day. Maybe like at the end of the day, I'm just like so tired that, if I do exercises, I'm going to add to my fatigue. Maybe I should do it in the beginning of the day. So changing some of the parameters can help. The other thing which also helps is like, there's a scale we call like modified Borg scale. So we've all used the scale of like 1 to 10. We've heard it in doctor's offices and stuff where, oh, if you have pain, the worst pain is 10 out of 10. If you have less pain is 1 out of 10. Sometimes using the same scale in the fatigue reference is also helpful. Make me keeping a diary or some form of log that I started this, and I'm just sitting before I do the exercise. I'm at like 3 out of 10. And I just want to be mindful of my own body signs and, just getting more attuned to my own self. So if I do like 20 repetitions of something and my fatigue goes to 6, and I'm waiting for like 2 minutes and the 6 is not coming down, and if I do more, it's going to go to 10. Maybe I've done it too much too quick. So I need to just break it down and then calm it down. And trying those things for some time, if that doesn't help, then maybe you're not ready to do the exercises on your own. Maybe you need to do it under supervision for somebody. So at that point, I'll be reaching out to the doctor for a referral for outpatient therapy.
Thank you for the very thorough response. Thank you.
Yeah.
Okay.
Anyone else have any questions? Please jump in.
Okay, I got another question.
Yeah.
So I gave everybody time. And again, if you've already covered this, I do apologize.
No, please.
Mental health obviously is a factor in this.
Yes, absolutely.
So have you? Forgive me if also I'm not up on the different. Like I noticed that some they've published some of the side effects or reactions to the various vaccines that are available. And I'm curious how long, like for, I'm sorry, I'm staring through this whole question. So in terms of like the depression that can set in, how long after like the vaccine, like does that
dissipate?
Yeah.
I don't think there's anything like set out for that. I mean, I think the vaccine is still so new that a lot of these questions are still unanswered. But what I can tell you is like just working with, some of the patient population from last year, there's a little bit like a touch of PTSD, which has set in, whether we're suffering from COVID or whether we have seen somebody suffering from COVID or just pandemic itself. So I think those factors are there. There's like, it's not like a true PTSD, but it's a very traumatic event, just like the loss of independence is a traumatic event. So I think it all depends on it. If somebody had a pre-existing condition, if there was a pre-existing condition of anxiety, depression, or any kind of mental health disorder, which was before, the chances are, they probably got it compounded. So I'm not too sure if I'm the right person to give that timeline, like how much time after vaccine it's going to go away. I think if it's still bothering and it's affecting the quality of life, then maybe reaching a mental health professional would be a good source point at that point, if there hasn't been none in that case. And then maybe either adjusting the medication or going on counseling, or maybe just, finding other ways of maybe like outpatient therapy, like not just mental therapy, but physical or occupational therapy, just to help with those symptoms. Because inactivity has been researched, like, or like the inactivity has caused a lot of these symptoms, like even like to exaggerate it.
Yes. Yeah, the person I'm talking about, this is definitely those are definitely factors. So I appreciate that. Thank you for the clarity.
Yeah, and you know what? Like before I started this talk, I was talking to Karina that like I'm seeing a lot of patients in the clinic, and it's like a lockdown. Like these people, like the fear factor, especially when the pandemic was at the peak, like, we were washing everything like crazy. We were just going in the stores and looking, and like the neck is like glued to it. Like people are getting dizziness, and people are just like the fear response. And that is adding to the trauma. It's very traumatic. So, a lot of the symptoms, as I said, like they mirror kind of like PTSD. They're not, I don't know if, we can coin them PTSD, but there is a touch of those things there. So I think it's very important to look into the mind and body like combined and be aware of our symptoms. I think that's knowledge is the key. So if there are some things which are there, symptoms are there, and it's impacting a quality life, then we have to reach out and we have to talk it out.
So, okay, I have another follow-up question.
Yes,
So, what do you recommend for people, speaking of like the trauma and the fear, but and the people that have been homebound through all of this, or in terms of re-entry into the public sphere, re-entry into those spaces, once, hopefully, by the fall, if we reach herd immunity and we reach a sort of return to so-called normal life, for those people who have, been, I don't know if we want to call it paralyzed by the fear, or who have been deeply affected by the anxieties and the fear that come with, being around people, and who have isolated as recommended, the re-entry into the spaces. How do you, is like, do you recommend maybe like a sort of, I don't know, like a stepping up process, like go to a room go to a space with 10 people, go to a space with 50 people, and then sort of gradual?
I think it's a gradual. I mean, I would start even saying, just go out for a walk on your street. Again, it's a personal preference. I mean, like hopefully we all are vaccinated and then, kind of reach that immunity. So I think that's important. But just like going out for a walk. The other thing is, like a lot of the outpatient therapy places, they are maintaining the social distancing. We're still under the guidelines. It's very clean. Maybe just starting out there, just if you're not too sure of like, going to the mall or going to a public place, just go to a supervised, like work one-on-one and gradually increase the activity level. Because we're all social beings, so just like having no interaction, it's not good. It's really not good for anybody. So increasing the social interaction, I mean, like hopefully, as I said, like a lot more people are getting vaccinated. So hopefully we can see the family more, the friends more, but still it's the baby step. The new normal still has not set in. So it's just like step, we all have to like kind of hold each other's hand and help. Just maybe finding one partner to walk with. I have patients who have not walked and they're like, I don't have anybody to walk with. And I've shown them like podcast or, like audiobooks on their phones and stuff or downloaded those apps. And I said, just put the plugs and then just go. Now you have a walking buddy, you know, so we just have to find ways, creative ways to help each other and get out of it. But, you know, just in a nutshell, if somebody's still very reluctant to take steps, I think I would just reach out to the doctor and then get a therapy prescription. I'm not like, you know, just saying it just because I'm a therapist, but I think that's what is going to help. Or maybe find a personal trainer and who is, you know, working more in the either home settings or settings where they're keeping all the CDC guidelines and precautions, which most places are, then, you know, just go for it. But I don't know if I'm in a favor of just jumping to the gym, you know, if we haven't done anything like in a year. You know, it has to be a slow, gradual process so we don't incur more injuries. So that's my thought.
Thank you. Okay, I'm done now.
No, please ask more.
Thank you so much, Shaloo. So incredibly informative. Fabulous. Does anyone else have any questions? Or if Joy, do you have more follow-up questions?
No, I'm trying to be good. It's good.
No, it's good. And, you know, if anything pops up, if anybody has any question, maybe now or later, just feel free to shoot me an email. You know, I'll be more than happy to share what I know or whatever, or maybe point to the right source.
Okay. And maybe we can put your email in the chat.
Yes,
is that
please.
all right?
Yes, absolutely.
Okay. I shall do that.
And if you want, I can even, you know, share the slides I can send you if you want to, you know, send it out to anybody.
Sure, that would be great. All right, and here is Shaloo's email. And thank you all for coming. I know that you all learned a lot to digest. If you have any questions, you now have her email address and you can contact her. And we'll be seeing her again, that's for sure. So keep your eyes on the Piscataway Library website and find out when she's going to be coming back and joining us.
Thank you, everybody. Thank you again.
Thank you.
Have a great afternoon.
Bye.
Bye-bye.